Cultural competence is about more than just knowing where someone is from. It's about deeply respecting the tapestry of beliefs, values, and traditions that shape a person's life. In nursing, cultural competence is the bridge to truly understanding our patients. It's about recognizing that a one-size-fits-all approach to care simply won't do. When we embrace cultural competence, we create a space where patients feel seen, heard, and valued. This connection is essential in all areas of healthcare, but especially in mental health, where vulnerability is heightened. Imagine a patient struggling to articulate their deepest fears or anxieties. Now imagine that patient feeling understood, not just in their words, but in the unspoken language of their culture. That's the power of culturally competent care. It's about recognizing that our own cultural lens shapes our perceptions. As nurses, we must be mindful of our own biases and assumptions. We must be willing to learn from our patients and their families, to ask questions, and to be open to perspectives that may differ from our own. This journey of cultural understanding is ongoing, a lifelong commitment to providing the highest quality care to every individual we serve. In mental health and disability care, cultural sensitivity takes on even greater importance. The stigma surrounding these conditions can be amplified by cultural beliefs and practices. What might be perceived as a sign of strength in one culture could be interpreted as a symptom in another. We must tread carefully, always approaching our patients with empathy and respect for their lived experiences. For example, some cultures may view mental illness as a spiritual imbalance, while others may see it as a physical ailment. Disability, too, can carry different meanings and levels of acceptance across cultures. Open communication is vital. We must create a safe space for patients to share their beliefs and concerns without fear of judgment. This means actively listening to our patients, seeking to understand their unique perspectives. It means involving families and support systems in the care process, when appropriate, and respecting their cultural norms. By approaching each individual with cultural sensitivity, we create a therapeutic alliance built on trust and understanding, fostering hope and healing. We all have biases, whether we realize it or not. They're ingrained in us, shaped by our upbringing, our experiences, and the world around us. In nursing, recognizing our biases is crucial. These unconscious biases can influence our interactions with patients, potentially leading to disparities in the care we provide. The first step to overcoming bias is acknowledging that we all have them. We must be willing to examine our own beliefs and challenge our assumptions. Education is key. We must actively seek out information about different cultures and strive to understand the historical and societal factors that contribute to health disparities. It's about asking ourselves tough questions. Am I treating this patient differently because of their background? Am I making assumptions about their beliefs or practices? Self-reflection is a powerful tool for growth. By being aware of our biases, we can start to dismantle them and provide equitable and compassionate care to every patient. Each patient brings a unique set of experiences, beliefs, and values to the healthcare setting. These differences should be celebrated, not feared. When we approach our patients with curiosity and an open mind, we open ourselves up to a world of learning. We begin to see the richness and beauty of human diversity, recognizing that our differences make us stronger. Practical steps can be taken to bridge the cultural divide. Language access is essential. Providing interpreters and translated materials ensures that patients can fully understand their care plans and make informed decisions. It's about being mindful of cultural practices. For example, dietary restrictions, religious observances, and family dynamics should be respected and incorporated into care plans whenever possible. Ultimately, cultural competence is about building bridges of understanding. It's about recognizing the inherent worth and dignity of every individual, regardless of their background. When we embrace diversity and strive to provide culturally sensitive care, we create a healthcare system that truly serves all.